Happy Wednesday, November 15th. Here with Dr. Karan Narwal. Thank you all for joining. Those who are here, we're going to wait a couple minutes. While you're joining, please, if you can, in the chat box, if you guys can hear me, just type in where you're tuning in from. Dallas, Texas, Honolulu, Hawaii, Wayne, New Jersey. We want to hear where you are tuning in from, because this will have a relevant anecdote to start off the webinar today. And thank you all for being here. How you doing?
Absolutely, thank you. I'm good. You know, it's Wednesday. We're getting close to the holidays, and the holiday theme music's in the air, so that's always nice. And getting inundated with Black Friday deals, so that's always fun. But I'm excited to do this call today, and I think we have a lot of great information to share, and we have clients and providers from all over the country. So just excited to get this ball rolling and have this chat with you guys.
Awesome. Brent calling in from Boston, Massachusetts. Thanks for being here, Brent. Appreciate you. Okay, so to kick us off, we got a Eugene, Oregon, Dr. Shaw. We got a severe curveball thrown our way just yesterday about this webinar. And that was actually Janssen canceling and saying that they could not be here. So I just want to, number one, apologize to you guys. They were supposed to be on the webinar, and we're still going to go through the webinar. And Dr. Curran's going to do an introduction, his clinical and business background. So we're still going to be discussing Spravato, the benefits, how you can add it to your practice. But I do have to apologize that Janssen will not be here. Apparently there was they believed that this would be a local presentation, which is kind of interesting because, we've got Boston, Massachusetts, and Eugene, Oregon, and Delray Beach, Florida. What they said verbatim, reading off the email, from what I understand, we did discuss this would be a webinar format. Oh, wait, I'm reading the wrong thing. We did not realize it would be a national presentation. Unlike when we were asked to give a local state presentation, national presentations need to go through marketing, and therefore it is out of scope for us. So look, I don't want to give my opinion. I'm just being objective, and we work with lots of Spravato clinics around the country. And following this webinar, we will give you the proper contact information to get in touch with them. But unfortunately, they claim because this is a national presentation that they couldn't be here to speak about it. So if you want to leave, I totally understand. We'll make the recording available to you guys. With that said, I'm going to introduce Dr. Curran, who many of you have talked to and know. And Dr. Curran had a successful 7-figure mental health clinic in the Tampa Bay area. And so here's somebody not just from a manufacturer, device, or pharmaceutical, big corporate company, but someone who is actually in the trenches every day doing patient care. So again, I do apologize that they are not going to be here. But with that being said, Dr. Curran, I'm going to pass it over to you so we can learn about Spravato.
Thank you. And Dr. Gomez, I agree with you. Whatever Janssen. Yes, as Scott said, their correspondence did indicate that they did not understand that this was going to be a national presentation. During my conversations with Diana Petlak and Toya Bowles, who was actually one of the PhDs behind Janssen's introduction into Spravato for the treatment-resistant depression landscape, we discussed with them at length what we do here. And so for what it's worth, and to Scott's point, I know we apologize, and rightfully so, we do apologize for those of you that are joining today to meet with Spravato reps, but this is how big pharma works, guys. I think we all know that. I've had my experience with them, and it's really unfortunate that here we have an opportunity to A, help the provider expand their services into a certain market, and B, gain some direct insight. So again, it's unfortunate. This stuff happens. I think most of us who are in this call today are aware of how big pharma operates and works. So again, apologies that they're not here today. We got this thrown to us literally last minute, which I also thought was very unprofessional. I Definitely aired my grievances in the most polite way. I'm sure a lot of you that have talked to me directly know how that can go. But regardless, let's get into it. So, as Scott mentioned, yes, I do have my experience in a private practice clinic ownership perspective. And we will go into some nitty-gritty details about Spravato, from starting Spravato, treatment indications, operational discussions, as we talked about in our email campaigns that came out to you guys, efficacy discussions, outcomes, and we'll definitely have an open discussion about some of you who've had experience with using Spravato and what that's been like for you. And that's something that I think I want to dive deeper into. With that being said, let's talk about what exactly is the purpose and goal of today's call. Mental health care is going into a very comprehensive model. And it's funny, Scott and I on a call earlier today talked about the word comprehensive. It's a very fluffy word, right? Everybody knows that a lot of your competitors or even yourself, we say the word comprehensive mental health care. And a lot of providers that we work with, clients we work with, do offer comprehensive mental health care. But when we're talking about what type of services we're including into the mental health treatment realm, we have to look at objectively as far as what else can we provide to create more durability in seeing our patients respond. And in addition to that, making sure that the outcomes reflect some of the goals that we have for our patients. So talking with that, let's kind of dive deeper into what Spravato is doing for the general public. What are we hearing in terms of starting Spravato? And just kind of get a basic understanding of what Spravato really is. So for those of you that aren't aware, Spravato, or esketamine, is a C3 nasal spray, which is indicated in conjunction with an oral antidepressant for the treatment of, as you all know, treatment-resistant depression in adults and depressive symptoms in adults with major depressive disorder with acute suicidal ideation or behavior. Now, most of you generally already know that, but what are some of the limitations of use that we have for Spravato? This is very important to know when it comes to the REMS criteria. And for those of you that are not familiar with the REMS criteria, the REMS criteria is the risk evaluation and mitigation strategy by the FDA if you are a Spravato provider to follow to make sure that the correct delivery, distribution, and providing of the treatment is followed accordingly. Now, with that being said, limitations of use. The effectiveness of Spravato in preventing suicide or in reducing suicidal ideation or behavior has not been demonstrated from an FDA approval standpoint. However, does that mean that it is not something that reduces the suicidal ideation for a lot of our patients? And that's a very tricky answer, because what we have seen from clinical outcomes, and we'll share some research today about this, is that Spravato has shown specifically to be very effective for patients in short-term and long-term results. One of the short-term results that we have seen in terms of the short-term study design that Janssen did, initially speaking, was with the addition of Spravato or esketamine with a new oral antidepressant, we were able to see 7.9% of patients receiving Spravato plus an oral antidepressant achieve a response by day 2. And we also saw during that time, by day 28, and let me just make sure I have this correct, or by week 4, 52.5% of patients receiving Spravato and an oral antidepressant achieved remission, with 31% receiving a remission with placebo and oral antidepressant response. So just throwing those numbers out there to give you some context behind some of the limitations of use, because again, it can become a very, very gray area in how that's presented. Now, going into some more limitations of use, we understand that Spravato, even though esketamine or ketamine are anesthetic agents, Spravato is not approved as an anesthetic agent. The safety and effectiveness of Spravato for anesthesia agent as an agent has not been established. So that's also really important to understand in terms of limitations of use. And we all know about the contraindications. Let's talk about that for a second. This Spravato is contraindicated with patients that have any type of aneurysmal vascular disease or any type of arteriovenous malformation. If there's a patient with a history of any type of internal brain bleeding or intracerebral hemorrhage, or any hypersensitivity to anesthetic agents as well, you do have contraindications there. And we do know that in the clinical trials with Spravato, I'm not sure how many of you are aware of this, but in terms of the sedatory or sedation effects or loss of consciousness, there has been 48% to 61% of Spravato treated patients do develop sedation type responses, and at the same time, 0.3 to 0.4% experienced a loss of consciousness. Now, for those of you who do offer Spravato, I'm really curious to know, does that reflect what you have seen in clinical practice? Do you find that a lot of your Spravato patients, are there predominantly a significant amount higher that have that higher sedatory effect? And how many of you have seen clients or patients of yours that do have a loss of consciousness? I'm just curious to know. And you can throw the answer into the chat section or the Q&A. And as you think of those numbers, I'm also curious to know the disassociation percentage. The most common psychological effects of Spravato were disassociative or perceptual changes, right? And those of you who talked to me before about best practices, I don't like to use the word hallucinations with patients, but the distortion of time, space, sight, body, sound, these derelation, depersonalization, those have been pretty dominant as well. I would like to know what that has been for most of you. So if you'd like to share that with us, please let us know. Because again, what Janssen provides in terms of data points can be very different in terms of what we're seeing in the real world setting, right? So I want to highlight that to you guys as well. Now, going into Spravato indications, let's talk about which patients are we talking about that are great candidates. And just so you're aware, this is some of the stuff that the Janssen representatives were going to go over with us anyway, so I'm just doing that on their behalf. Now, when we're looking at the indications, Spravato, let's not forget, it is for use in conjunction with an oral antidepressant for adults with treatment-resistant depression, which is defined as major depressive disorder patients who have had an adequate response to 2 or more oral antidepressants, or depressive symptoms in adults with MDD with acute suicidal ideation or behavior. Now, we talked about the limitations, right? But let's look at the effectiveness and the Spravato efficacy and what that tells us. So going back to the short-term and long-term study results, I mentioned some of the short-term. Let's look at the long-term study results and what that's telling us. We know that with the long-term study results, there was a significant amount of data that had to be collected essentially in reference to what those patients were responding to. So looking at it from a long-term study standpoint, and I'm just going to pull this up correctly so I have this right. My apologies, 1 second. Okay, the long-term study, and this was an open label long-term safety study with no comparator group. And again, this is a generalizability of study findings that may be limited by patients who choose to continue from their parent study. What they found that the patients, looking at patients here, and here we go. There was I'm sorry, I'm just trying to make sure I have the right data in front of you because there's lots of data in front of me right now as we're looking at it. The 4-year treatment-resistant depression safety analysis was at 5.1% of patients taking Spravato discontinued due to treatment for adverse events during that period. So what that tells us that 95% of those patients, or a little less than 95% of those patients taking Spravato treatment, did not have to discontinue. So we do have a lot of patients that use maintenance indications and things like that. So we want to emphasize that there is some long-term durability. Now, we have a lot of clients that offer TMS and Spravato. I know the durability can be very different with both. There has been indications that there are long-term durability responses with TMS compared to Spravato. But the nice thing about using TMS in conjunction with Spravato is that there's specific ways to include a maintenance protocol that you can apply with the Spravato treatment. So for example, if a patient has a response to Spravato, but it's not as durable, we've seen TMS to keep some of that durability going for some patients. At the same time, do we have patients that don't respond to Spravato that respond to TMS and vice versa? And the answer is yes. That's something that we have to think about. So every patient's different. We know about that. But from the side effect profile, there are certain things to consider in terms of contraindications and, more importantly, where the patient's response would be during that time. So going back to the long-term study results, I'm curious to know from the provider standpoint, for those of you who have offered Spravato in the past or have worked with somebody who offers Spravato, what has been your take or your personal opinion on what the long-term results look like for Spravato? If you had to ballpark a number, I'm just curious to know. Does anybody want to share what that number looks like to you?
we could actually bring someone into the webinar. We could allow to talk or bring into the webinar. So if you're not shy
Sure.
to have an open discussion, you do the raise your hand feature or type in the chat box.
No worries. Okay. Well, let me pull up the most recent studies that we have, and I'll share this one. Janssen did do a study that they funded, done in China. This was done in 2023, 2022 this year. Sorry, 2023. It was the efficacy and safety of flexibly dosed esketamine nasal spray plus a newly initiated oral antidepressant in adult patients with TRD. This was a randomized, double-blinded, multi-center active control study conducted in China and in the USA. And this is a phase 3 multi-center study. I'm sure a lot of you were aware of this data. They were showing during that the difference between treatment groups at day 28 was not statistically significant difference in least square means or 95% confidence interval. What they did show that was esketamine plus an antidepressant demonstrated a clinical meaning treatment difference compared with the antidepressant plus placebo. And we know we're talking about our MADRS scale of at least 24 hours after the first dose of the overall study population. So the conclusion of that study indicated that esketamine plus the antidepressant was not statistically superior to oral an antidepressant plus placebo improving depressive symptoms in TRD patients at day 28. But they did see a rapid reduction in depressive symptoms within 24 hours. So between day 1 and day 2, there was a rapid discussion, which is indicative and also reflective of what some of this Spravato literature has shown in terms of what that looks like. I do see a question here about if we're able to see the slides as well. There isn't necessarily a slide deck, but what I will share with you guys is the website to go reference a lot of this information. Spravato and Janssen have provided a specific website for Spravato providers. If you're interested in starting Spravato treatment into your facility, or if you already offered and want to have some background information, marketing material for your patients so they can understand a little bit more about Spravato and what Janssen does, the website is spravato4hcp.com, and I will throw it here into our chat box. So once again, it is spravato4hcp.com. Please take a look at that website. It is extremely, extremely helpful. There's plenty of different discussions about Spravato, starting patients, treatment center operations, coding and reimbursement for those of you who are curious to know more about that. There's some great discussion points there as well. Now, going back to, and I hope that was helpful there. That's another question here. Oh, no, that's the same question. Okay. Going back to some of the data points. The chat is disabled. Let's see. Okay, fair enough. Thank you for sharing that with us. And thank you, Scott. I think that should be sent to everybody. Perfect. Yeah. Awesome, awesome, awesome. Now, let's go back to some of that long term. I wanted to pull that study up because there is something here to look at. So, and for those of you that are asking if we can share that with you, Scott, would you mind if I share that screen?
Yes, absolutely.
All right, here we go. So let's take a look at this. All right. So when you go on this Spravato for Healthcare Providers website, what you'll see is essentially a lot of different tabs here. We're kind of going through each one of these for you, but we wanted to emphasize the importance of having a conversation with Spravato representatives about this. How are we able to find out who our rep is? What we can do is set you up with our contacts at Janssen, and you can reach out to them directly and they'll set you up with your local representative. They do have account reps in each part of the country, so there's someone you can talk to directly specifically about what they can do for you as far as being a Spravato provider. I can tell you that they are very helpful directly. Unfortunately, in this situation with us, we weren't able to get them on this call. Now, going back to the starting patients tab, going back to the about Spravato, here's the efficacy and safety indications. So those long-term and short-term results are all posted here, as well as your head-to-head study results. So when you click on that, it'll bring you up to some of the proven efficacy with safety evaluated in over 1,700 adults with TRD. So these are your phase 3 and phase 2 studies that were done. All that information will be here for you as well. And for those of you that are curious about the dosing, the indications of how much dosing to provide and what the induction and maintenance dosing looks like from the 56 milligram to the 84 milligram differences. They do discuss that here in a lot of detail. And is there going to be a question and answer part of this Zoom? And yes, there will be one. Scott, thank you for answering that as well. We will have the question and answer part of this as well. Now, just so we're aware, the MDSI data and dosing that they have, this is the depressive symptoms in adults with MDD with acute suicidal ideation and behavior. So a lot of the data points reference this discussion right here. Just keep in mind that there is a lot of literature out there on NIH and overseas research studies that talk about Spravato and the efficacy of Spravato. What I'd like to focus on is what Janssen provides on this website. The research that I'm referencing is through Janssen and through nobody else. There are some self-funded studies, private clinic studies with the use of esketamine along with oral antidepressants and TMS. I think that's really helpful. But again, for purposes of today, we want to make sure we stick to what we know here. Now, looking at starting patients, treatment referral centers. So let's say you do want to start Spravato treatment in your office and what that looks like. They do have a refer a patient system or SOP to follow with local providers. So your Spravato rep will actually work with you to work with different providers in your area. Let's say your patient sees a primary care provider who prescribes an antidepressant to that patient, and you would like to have a educated discussion with that provider. Spravato can assist you with these services. That's one thing I really like about what Janssen does in terms of making sure that there is some application of having a referral process in stone. There is a referral form that Spravato provides for you as well, so you can integrate this into your website, or if you want to send directly to referring providers, you have that option as well. And if you do become a Spravato treatment provider, you will become a part of their national database. So finding a treatment center, let's say you provide Spravato services and you want patients that are looking at Spravato treatment in your area, they can look you up through Spravato. And does this help some of the SEO efforts? That's a question I would leave to Spravato. But I know with my experience with the TMS device manufacturer, our presence on their website directory did help some of our search results populate for TMS in our area. So that's something I'd like to mention as well. Now, there are steps to starting patients, and obviously there's a lot of things to consider, but you have to transfer your practice into a Spravato treatment center. The one thing I advise a lot of our clients on, and I'm sure Janssen would say this in a different way, not to make Spravato the main point of what you provide as a service or treatment. It is an additive part of what you offer in mental health treatment comprehensive care. There is something that I mentioned to a lot of our clients in previous calls, that mental health is going towards a Walmartify effect. I want to go to one location and get as many services as I can and not have to go to different providers. So if you have a therapist, a nurse practitioner, a medical a physician or provider that can handle medication management, provide TMS, you want to make sure that it becomes one avenue of your treatment, not the sole avenue of treatment that you provide. So when you start a patient, looking at the indication of whether that patient's a candidate or not is also important. We know that some patients don't want to go the medication route, which I can understand. But for reimbursement purposes, that is something that's very important. So when you're starting a Spravato patient, you have to know, does the patient meet criteria, which is inclusive of getting the insurance or reimbursement in terms of how many medications they have tried. So that's something we should definitely reference as well. Now, going back to treatment center and operations, let's look at that for a second. And actually, we have a question here. Let me just stop here for a moment. What are your thoughts on using ketamine microdosing regimen like the one offered by Joyous after ketamine treatment to sustain its effects? That's a good question. I would say because of the off-label use of ketamine at this current state, it's hard to say specifically what are the regimens that we can apply here. I can say that maintenance or the usability of ketamine for ongoing durable effects of what ketamine can do, it's important to think about what is safe for the patient, right? We know that patients cannot continue ketamine infusions for the rest of their life. And we're talking about IV and IM specifically. There can be a certain induction of maintenance infusions over a certain period of time, but we know there's also long-term data about adverse effects in terms of interstitial cystitis or having any type of bladder issues as well, along with multiple other indications. But there's something to consider in terms of how that works. But to answer your question, I would say if it's sublingual and it's something low dose, it's definitely something that can be done. It's just a matter of what is the treatment protocol post the treatment as well. And what I'm talking about is integration. we're talking about the patients having a neuroplastic response. We know that esketamine and ketamine have a direct response to BDNF, or brain-derived neurotrophic factor. And we also know from the mTOR cell process how there's this regulation with cell growth that takes place. So it's really important to remember that rather than, what are the regimens we can apply to continue the treatment, what are some of the integrations to benefit from the response of that treatment, I think are more pertinent and to think about. So hopefully that answers your question, and we can talk about that more in detail. Go ahead.
Okay, I'd love to jump in here too. So we met a group I was just at Wonderland with Adrian Hill, our director of client success, this past weekend. And we met a group where all they do is the integration service for psychedelic clinics, coaches, etc. So as much as, hey, what's the regimen? It's, are you going to be willing as the business owner to either have that be part of your cost of goods, adding that integration specialist? Does that come from your business, or would you hire a third party to do that integration? Especially at home, you're outside your body during a ketamine experience, you could get injured.
Correct.
So I feel like, and even our clients, we see that the clients who do have the integration specialists, whether it's outsourced or white labeled or as a part of their integration, they're going to have a better patient experience and better patient retention. So then you have to consider the business implications of, am I passing that cost along to the patient, or am I eating that cost? So all considerations for you in that.
100%. And that's a great point to make, Scott. I really appreciate that. And that's kind of the way to go. I think it's important to remember as a provider, and a lot of our clients that do offer a sole avenue of treatment, it's nothing wrong with that, but in essence of sustainability in this business, in this industry, in this space, I think it's important to kind of expand on what the integration looks like. And a lot of it can be done with additive product offerings. There's different ways to create that set and setting and that continuity of response. And one of the things we've seen some clients do is use biofeedback and neurofeedback as an integrative process with their treatment plans. That's something that we can definitely reference. Dr. Gomez, I see you have a question here about the buy and bill situation. Let's dive into that since we're going into that anyways. Treatment center operations, again, you guys have this website, definitely take a look at it. It's a wealth of information. The idea of today's call with Janssen was to go through all of this with you. So we're doing it on your behalf to the best of our ability. Again, this is stuff that, again, is available to you as information. But Dr. Gomez, for your question, let's answer that as we speak. So the coding and reimbursement, what does the buy and bill situation look like? Well, with the buy and bill process, what ends up happening is, and let's kind of go into, I just had it. So here you go. What you can see here, I don't know why this doesn't go down. All right, anyways. What you can see here is that Spravato does have a procedure code that begins with a J or S for non-Medicare recipients, because there is limited coverage. I believe no coverage at all with Medicare for Spravato, from what I understand. But there is a J or S code that works for that. And as long as you are able to add that with a code options for a new or established patient for observation and monitoring, that's what that buy and bill process looks like. The one thing I would like to reference is that you cannot necessarily bill for any type of, from what I understand, prolonged clinical staff service. So if you're having some sort of supervision of that patient post the nasal spray infusion, I know that there is only coverage for obviously physician-patient face-to-face time or prolonged service with direct patient contact with the provider. And that's what this J or S code references. Now, the G code is the usage or the combination of drug and service G codes for Medicare required or non-Medicare insurance plans that require G codes. Again, I don't want to get too granular into this because I don't want to mislead you guys, but I definitely think having a conversation with Janssen directly would be helpful in terms of how this would look. There's a link here about considerations, for payer discussions. One thing I can tell you from our conversations with Janssen right now is that there are discussions going around the board, the reimbursement model of what the patient's allocated responsibility is for Spravato versus what the provider gets reimbursed. And that is getting better. There's a lot of lobbying going on, if you will, in terms of making those rates more appealing to providers and easier on the patient. Currently, there's different structures of how those copays look. and the cost of the patient can be astronomical in some cases. So that would be specifically something to think about. Now, a question has come up about what are the typical out-of-pocket expense ranges that patients can expect. I can tell you from experience with patients that have worked with me for TMS treatment that have undergone Spravato, they have been anywhere from a couple of $100 up to $1,100 to $1,200 from my experience. I do know that there are some situations where there has been authorization of the treatment. The treatment will supposedly be reimbursed, but due to some sort of error, usually it's become clerical in this case, the patient has been stuck with the entire cost of treatment. But to answer your question, typical out-of-pocket expense cost, just like what we've seen with TMS, can be anywhere from a couple $100 to a little less or above $1,000. I can say that there are certain financial assistance programs that Janssen has offered or put in place for certain campaigns in the past. I don't know how that works currently, but there are certain things that are there. So to answer your question again, typical out-of-pocket expenses, that range can vary for a lot of patients. Now, looking at what insurances companies will pay for Spravato, I know that there have been a significant number of the insurance companies. We just talked about some of the Medicare and non-Medicare coverages, but I'm actually going to pull up another link of mine to make sure I have this correct for you. Let me just make sure I have it here. Okay. So the following insurance companies do cover Spravato, and to be specific, those are Blue Cross Blue Shield, United, Cigna, and then there are other PPO plus plans that have been able to cover it in the past. Humana Military does specifically TriWest. I can tell you that from experience with TMS, those reimbursement rates have been pretty high for our TRICARE and Humana Military coverage. But Blue Cross Blue Shield, United, Cigna, Aetna, Beacon, and there is a company called Zealous as well. And I'm just seeing anybody else that I'm missing in this list would be a good answer to provide. Let me just make sure anybody I'm missing. Okay. And also, just so you know, the dosing, if it's weekly or biweekly, that cost can vary. Sometimes the cost can range from $5,000 to $8,000, depending upon if it's done weekly versus biweekly. So it's a little bit less if it's weekly versus biweekly there. And that's not the total cost of the patient. That's what the insurance reimbursement comes into. Now, affordability, if you're eligible and commercially insured, there have been savings programs, as I mentioned before, some financial assistance, where some patients can pay for as little as $10. But again, it's a very, very, very low number of people that have been able to get that type of coverage. Again, I've seen some co-insurances where, typically speaking, the treatment has cost a patient a couple $100 to $1,000. Now, again, if you're eligible commercially insured patient, you can pay that $10 per treatment. There is a maximum program benefit per calendar year for most insurance companies. So something to think about. So if a patient does benefit from the Spravato and nasal spray infusion, and we can have a consideration of continuing the treatment, let's not forget that there per calendar year, there is an $8,150 maximum program benefit per calendar year for some insurance companies. So having a detailed benefits investigation for that patient is advisable. If you are the one who is providing that treatment of Spravato and you need to make sure you get covered, I would definitely have a lengthy BI or benefits investigation done. Do we have to have a specific pharmacy to get Spravato? I do not know the answer to that question, to be very honest with you. I do know that Spravato does arrange the providing element to this, but that's something I'd reference that question to our contacts at Janssen, which will provide that information to you very shortly. Just so you know, Spravato, because of how delicate this treatment is, because there's a lot of legal limitations, medical concerns and contraindication concerns and criteria eligibility elements to be met, there is a lot of support from the Janssen group to make sure that you have the resources. So that's something that they'll set you up with in terms of who you get your Spravato from, how is it provided, and all that good stuff. And that link that shows what insurance will reimburse, absolutely. If you go to that website that Scott had sent earlier, you will see on Spravato for HCP.com. If you go back to it, and let me actually just do that for us. If you go here, click on coding and reimbursement. Here you will see how to navigate your payer coverage and reimbursement. Spravato with me, which I believe is a process to help providers and patients with dedicated case managers. And this is a great resource because it's a direct line to somebody who's a dedicated case manager to provide you with educational support and resources. So something you can do here as well. And again, a lot of access to reimbursement support, medical and pharmacy benefit coverage. As I mentioned to you guys before, it's great to have a lengthy benefits investigation done so you can do all of this with them. Prior authorizations requirements. There are some prior auth processes in place with certain insurance companies, but just like TMS, it's very straightforward. Basic collateral information from the patient. If they have tried antidepressants, how long they have had that diagnosis. Make sure there's no contraindications to that diagnosis. These are things that are very important as well. Now, going back to another question we had. Oh, that's it. All right, perfect. Now, one thing I'd like to mention is that this REMS certified pharmacy option, the REMS criteria, this is something that Spravato will provide support for you directly. So you don't have to worry about finding how to get REMS certified. That's what Janssen's there for. As much as I like to be an opportunist in this situation, I would say 100% use them for everything you possibly can. Why? That's what they're there for. They have clinical liaisons, they have business liaisons. And that's why we wanted to have this call with them. Again, I apologize for a lot of you here today, and I'm trying to do my best, as you can see on my end, provide you guys some support and information. But what we know with Spravato and Janssen is that their entire system and process since 2019 has been improvised and has been effectively changing to make sure that providers have the support they need. Because there's so many questions from a reimbursement standpoint. Who is the right candidate? Will I actually get paid? Right? Certain questions that are very important. And I think this is where Spravato as a partner or Janssen as a partner for you can give you those resources. And speaking of that, if you go to the resources tab, you will see that there are a number of resources for clinical research, treatment centers, referrals, and for your patient as well. A lot of the things that we do at Beyond Marketing are to make sure that patient education is paramount prior to you establishing your business or your outreach for a patient. So what we say to a patient and how we present it is also important. So we have a lot of that information here as well. So you can actually create specific or use their brochures and add some of that content to some of the campaigns that you have in terms of your outreach as well. One thing I also want to mention to you here is that there are things on the Spravato website in terms of FAQs, patient-facing questions and answers that we can directly plug into your website. So something that we've done with a lot of our clients in the past, if you wanted to make a part of your website for your patients that are more informational based about Spravato, I have discussed this with Janssen, and fingers crossed they don't turn our backs on this as well, but we were able to extract some of the content from Janssen's website and plug it onto your website in terms of clinical content, outcomes, data, and things like that. I know a lot of you have talked to me about best practices. When you're talking to a patient about a specific treatment or a service, talk about the percentages of what that response has been like. I'm not saying sell the number, but yes, as a patient, as a consumer, I'd like to know if you're telling me I should consider Spravato, why? What is the number that has stood out to you? Let's talk about that. The efficacy of Spravato we've known has been very varied from, and I'm talking about nationally speaking among some of the clients I've talked to and some of the data that has been shown in some of these studies can be anywhere from, I believe, 51% up to about 80% for some providers. We have had some robust responses with Spravato treatment in outpatient settings. And why is that? Why is that different than what the research shows me? Again, the research are open label, multi-site studies that aren't necessarily integrated. And there's lots of social determinants of health to consider when these studies were done. 2019 versus 2023 are very different in terms of the mental health landscape. So what some of the outcomes may look like back in 2019, 2018, 2017 can be very different today. And on top of it, the real world outcomes I'm looking at are what outpatient providers are providing in terms of support for patients that are receiving Spravato. So the numbers do look better in the real world setting. And again, that's because credit to you as providers and clients of ours that you are going above and beyond for your clients. And by that, I mean, you're providing integrative services. You're making sure that the medication management is up to par. You're making sure that therapy is something that is being advised and included into their treatment process. Again, I'm talking about brain-derived neurotrophic factor kicking up a notch. What does that mean? Neural pathways are opening. What does that mean? When we're talking about Spravato, we're talking about increasing glutamate and affecting those NMDA receptors. We're talking about patients processing more. So for long-term patient outcomes, the data can be very, very varied. But from what I'm seeing and talking to a lot of you, is that these numbers are looking a lot better in the public landscape. That's something to consider. Now, with that being said, let's open this up to some internal dialogue here. I'm going to stop share for a moment, and I'd love to have a discussion. And the thing is, we have, Scott, is this right? We have about 40-something people on this call today.
Yep.
40. A lot of you have, perfect. So a lot of you offer Spravato, offer ketamine, infusions, IM or IV, offer sublingual. So let's open it up. What are your thoughts? What are your experiences? What are you curious to ask or know more about, or what do you want to share in this discussion about where Spravato is in your perspective, and what can we do to kind of enhance patient care and access to treatments like this?
Yes, and we can even bring you in as a panelist / allowed to talk. These are the Zoom options. So if you want to share how you're using Spravato in your clinic, positive benefits you're seeing, that'd be great as well. Or if not, Q&A works as well. And Dr. Karan, you did an amazing job. You know, life throws curveballs at you, and we were scrambling last minute, everyone. And thank you. You did.
I appreciate that. Really I appreciate that. I want to be as informative as I can, but I don't want to misspeak on anything that we aren't, aware of. But thank you, Dr. Gomez. I do appreciate that. Jessica, you have a question. Is Spravato considered an effective maintenance protocol for people who have done quite a bit of ketamine infusion therapy? The answer to that, from my perspective, is yes. One of the reasons is the safety profile for nasal spray esketamine is a bit more fruitful in nature. And what I mean by that is that the bioavailability is a lot less, right? We know that with intravenous ketamine, there is the 100% bioavailability, which means more of that drug is being metabolized. So from a effective maintenance protocol with doing the least amount of harm, yes, to answer your question, it would be an effective maintenance protocol. A lot of our clients that offer IV and IM ketamine, I've always said to them, if you have a patient who has a great response to this ketamine infusion and you want them to continue with that response and make sure there's more durability to it, the consideration of Spravato might be something warranted. So 100%. Thank you, Jessica. I really appreciate that. And thank you as well for joining today. Tamoya, anyone that has been providing Spravato, what has been your experience with insurance companies reimbursing? Is it taking lots of support, staff, and time? I'm going to open that question up to everybody here today. Would you like to share what has been your experience with the insurance companies, provider relations, reimbursements? And to that question, Tamoya, aside from Spravato, insurance companies have provider relations representatives that you can speak to directly about this in terms of what Spravato can do and can't do. They're a great, great asset and resource. I use my provider relations rep for Blue Cross Blue Shield all the time, to the point where I think I was calling her like at least twice a week. So I'm sure she loved me when I call her that often. Anybody have any feedback on what your experience has been like with insurance companies, reimbursement? I know a few of our clients I've referred to for Spravato and you've been incorporating into your practice. What's that been like? Okay, no worries. Well, let me pull up. There's a little data point I was looking at a while back about insurance reimbursement for Spravato. And let me see if I have it here. Let's see. Okay, so just pulling this up. So the 28 milligram or 56 milligram dosage is around $784 for a supply of 2 sprays, right? We know that that's that supply, or sorry, that cost. What we have seen is that without insurance, again, per calendar year, there's a certain amount of cost that can add up, but As far as what the insurance companies do, there hasn't been a significant amount of denials once it's been approved. It's almost always covered by the insurance companies. As far as reimbursement time, we have seen reimbursements take at least, sorry, it shows you, and this is from experience with some providers I've talked to, they have gotten reimbursement for Spravato within 4 weeks. We have had one client tell us that it's taken them a little bit about over 5 to 6 months to get reimbursed. Now, for whatever reason that could be, maybe there was something in the authorization or in the patient's patient history that needed to be clarified through an appeal process or something of that nature, which does happen. Sometimes when you submit a claim, it gets rejected or denied, and there's reasons behind that, and they'll give you the identifier as to why. Sometimes that can take a couple of months. I have not seen Spravato reimbursement take longer than 6 months from what I've seen here. And as far as is it taking lots of support staff and time, that's a great question, Tamoya. This is where I say milk the cow as best you can. What do I mean by that? Use Spravato, use Janssen. They have reimbursement representatives that you can directly speak to as a provider. One of the nice things about getting in bed with these big pharma people is that they have people all over their company that are directly involved with this type of stuff. And what I did with and just to give you an example, with my TMS device manufacturer representative, I had him on my cell phone. We got together every now and then. But if something wasn't wrong, I did not go through an email and say, what's going on? I call them directly, hey, I'm not getting reimbursed. What's going on? Or my insurance reimbursement rates for my TMS procedures are looking really low. Let's get the renegotiation process going. So I didn't want to allocate my time and my staff's time to have to do that. So we ended up going to them directly. So to answer your question, Tamoya, if it does take a lot of staff time on your end, I would recommend directing that to Spravato and to Janssen. That would make a lot of sense. So hopefully that answers your question there. Any other questions? Okay. Totally off topic. What TMS device did you use? Okay, yeah, let's go into that. I use NeuroStar. A lot of pros, lots of cons. To be very honest with you, I think any company has benefits and drawbacks. One thing I liked about NeuroStar, this is where Spravato does come in as well with Janssen. They have a benefits investigation portal type of process. So if you were looking to make sure that there is coverage for your patient, and I'm just talking in reference going back to Spravato, if you wanted to look into what reimbursement looks like, how does that patient get covered? What is the, I guess you could say, considerations in terms of what the patient has to pay versus what you get reimbursed. There was a lot of support there from NeuroStar, so that really did help us. I'm using them as an example in today's conversation because your partnership with these companies are extremely important. They have to support what you're doing, and you have to get benefit from them. I know that certain device manufacturers and certain pharmaceutical organizations are heavy on marketing their products and services, but at the same time, I don't want them to look the only one who's going to look good. It has to reflect on you as well. So the way I look at it is it's a two-way relationship. And with Janssen, from what I understand prior to today's call, that's kind of what the gist of what they do is to support their clients and providers with the resources they need from every element to even appeals. One thing I did not have a lot of support with from NeuroStar was when I had an appeal or a rejection for a TMS authorization. So one of the nice things is that if you offer Spravato and the benefits investigation determines that Spravato is subject to restrictions or it's not covered or anything, you can submit a medical exception request and they actually give you that form and what that template looks like. I didn't have that with NeuroStar. I thought that was pretty helpful. And I think that's really helpful to anybody who's looking to provide additive services and value in terms of getting their patients covered. They give you a sample of a medical necessity template, which you can use. You can put your own logo on there, whatever you need. And you can submit this letter to the payer either with the initial claim or when you're requesting a reconsideration of a denied claim. One thing I will say that Janssen and NeuroStar did with us was tell us to appeal, keep appealing. if you get denied, that claim gets rejected, eventually someone's going to, have to make a decision whether or not I'm going to continue the appeal. And we've heard in personal experience, I've had an appeal come through and a claim get paid after like 3 appeals. It took us like 14 months to get reimbursed, but eventually we did. So just something to think about, right? So hope that answers your question. And yes, it was Neurostar. So Tomoya, we're not a mental provider, so I'm assuming that we need a referral from such with the appropriate diagnosis. Yes, the answer would be yes, you need a referral. But one thing I want to mention: who can offer Spravato? That's a big discussion point as well. So who can provide Spravato? Not every healthcare provider can offer Spravato going through the REMS criteria. So to answer your question, the innovative treatment, which is esketamine or FDA approved, it's prescribed by a psychiatrist or a psychiatric nurse practitioner. From what I understand, I don't believe if you are an anesthesiologist or in the family general primary care side of things that you are not able to offer Spravato. That will change as time goes on because, again, it's becoming a model of comprehensive care for mental health, and not every mental health facility directly has psychiatric nurse practitioners or mental health psychiatrists, specifically speaking. You can have therapists working with integrative functional medicine specialists, right? So that will change as well. But to answer your question, Tomoya, I think it's if you have a psychiatrist or a psychiatric nurse practitioner, you can offer the Spravato treatment and be a part of their provider network. So, absolutely. Any other questions, guys? All right. Let's see. Missing anybody? Let me see. What else am I missing here? Spravato isn't approved for anxiety, but something I did want to mention about off-label benefits of Spravato. There has been significant robust data that has showed that Spravato has been helpful for other comorbidities and co-diagnoses. Now, this is something that I think is kind of a little gray area. Should you document whether or not a patient has generalized anxiety disorder along with MDD? Sure, it's not going to necessarily, take away from the truth. But if the primary diagnosis is major depressive disorder, and we know a large number of the population that has MDD or TRD has a predisposition to having a comorbidity of anxiety, there has been some element of a response with anxiety as well. So studies have shown that ketamine, along with esketamine, have been helpful in treating anxiety disorders. We know how helpful ketamine has been for PTSD. So there has been some data that has shown that Spravato or esketamine has been helpful in reducing a patient's anxiety-based symptoms as well. So one of the nice things about this is, it can kind of kill 2 birds with 1 stone. And the answer to your question about this recorded video to the attendees, this will be available on our Move platform. So if you go to our learning center and our monthly calls, you will see this call posted there, along with our call a few weeks back that we had. Actually, last week with Psychedelics Today integration coach David Drapkin, which was awesome if you missed out on that. He's living in Israel and talked about his personal experience there. So I would love for you guys to check that out. And we had a call with Gentum, a mental health billing company that's using AI and technology in the most innovative ways to help clients or providers get reimbursed. They're also real good experts in the ketamine space and esketamine space as well. So something to think about if you were interested in looking at these calls. Any other questions, guys?
And we will send this video out to attendees because I know not everyone here is a client. I know this went out to 2 lists, client and prospect lists. So expect to see that before end of week.
Perfect. Thank you. And then let me see if I'm sorry. And I misspoke earlier. I mentioned Spravato not being covered by Medicare. I misspoke. It is covered by Medicare, but for those of you who know how Medicare works, it's very complicated at times. And Medicare has been known to be a bit more on the denial end, and I don't know why that is, but it is covered by Medicare. So I just want to reference. I apologize for that confusion on my end. Any other questions?
When using
When
Spravato,
using,
oh, go ahead.
yeah, when using Spravato, you need to have a therapist present. It's a good question. I would say it's probably better suited to have a therapist do work with the patient when the disassociation has come to an end, um, or the following day, perhaps. And I personally think having the supervision of that patient during that disassociation is more important than the therapy. Therapy should be a part of the process, maybe integrated during that week, but I wouldn't say to have that therapist um, present may be as fruitful. Now, let's say that there's certain cognitive distortions that are coming up, or the patient's reliving certain traumas, and you're talking about a patient with MDD, TRD, along with a co-diagnosis of PTSD. I would say, it might be better suited, but it's a case by case basis. But with Spravato, I just feel like the work that needs to be done with therapy should be done in a sense when that patient is able to communicate effectively, and kind of work on some of the skills that are being presented to them during the therapy session. I don't necessarily think a patient who's having that side of a sense of distortion and disassociation may benefit as much as somebody who's able to collectively understand what's being said to them. Again, case by case basis, and something I think is subject to the patient's diagnosis as well. So I hope that answers your question there. Thank you. Any
Oh,
other questions? I love it. 32 questions today, 40 plus attendees. Thank you. Thank you. Thank you. This was really, really awesome to be on the call with you guys. And again, on as Scott said, we do apologize. Can't do anything about big pharma, right? But that's the world we live in.
well, hey, life will always throw you curveballs. And what does Mike Tyson say? Everyone has a plan until you get punched in the mouth. So I think we made the best of it, and this was super valuable. We have a lot of the resources posted. Thank you, everyone, for participating. We're off next week for Thanksgiving, but then we're back with Psychedelics Today the following week. That's last week of November.
Yes, and just for that call in the last week of November with Psychedelics Today, if you're interested in learning more about integration with ketamine, integration with psychedelics, David is a wealth of knowledge as an LMHC and LCSW. He's worked in England, the US, and now in Israel. He is, again, a wealth of knowledge. I'd love for you guys to join that call if you're interested in talking more about integration therapy with psychedelics and ketamine. Thank you, everybody. Really appreciate you. Thank you, Felicia, Jessica, and Jonathan Wayne. Appreciate all of you guys being here today.